Good day everyone, this is Kylie Meiji Tambali of BSN 2C and today I will be doing a Leopold'S maneuver. The purpose of Leopold'S maneuver is in order for us to determine the fetal presentation, position, and also the attitude of the fetal and of course the fetal lie. We are going to do this through systematically palpating the woman's abdomen. Note that the Leopold'S maneuver is done after 36 weeks of gestation. For the Leopold'S maneuver, we are going to use different equipments. The equipments that we are going to use are very easy to provide, where we are going to use a pillow for the comfortability of the patient. Now we have in here a towel. We are going to use this to avoid hypotensive syndrome to the patient. And now we have in here a gloves to avoid cross-contamination, and of course we have here a stethoscope. We are going to use this to hear or to listen to the heartbeat of the fetus. Okay, let's get inside the patient's room, and the first thing that we are going to do is to introduce ourselves and identify our patient. Ma'am, I am Kylie Meiji Tambaling and I will be your student nurse. Ma'am, may I know your name and your birthday?
I'm Lina, and my birthday on May 15th.
Okay, that's right. After introducing yourself, we are going to explain to the patient what is the procedure of what is going to happen during the procedure. And of course, we are going to ask for the consent of the patient. Ma'am, for today, we are going to do a Leopold'S maneuver, which includes, I'm going to touch your belly. Ma'am, the Leopold'S maneuver is also helps us to determine the position of the baby inside your tummy.
Yes, ma'am.
Okay. Would it be alright if I lift your shirt and I'm going to touch your belly and I'm going to add some pressure so we could identify the position and the presentation of the fetus inside your tummy, ma'am?
Yes, ma'am. It's okay.
Okay. Okay, the next thing that we are going to do is to instruct the patient to go to the bathroom and empty her bladder in order for the procedure to be more comfortable and of course fast and convenient. Ma'am, would it be alright if you go to the bathroom and take a pee so it will be more easier for us, and of course it will help us not to make any constructions during the procedure?
I'm already done, ma'am.
Okay, great. This time we are going to provide privacy to the patient. We are going to ask the patient if we could close the door and the curtains if she wishes to. Ma'am, would it be alright if I close the curtains and the door in order for nobody from outside could disturb us as we proceed to the procedure?
Yes, ma'am.
Okay. Now we are going to put the patient into a supine position. We are going to ask her to lie down and of course to flex her knees. Ma'am, would you mind if you lie down?
Okay.
Okay, like that. And we're going to flex her knees for relaxation of the muscles. Ma'am, can you flex it a little bit? Right there. And then we are going to use a towel and put it underneath her hip to avoid hypotensive syndrome. Ma'am, right? Okay, great. Okay, great. Thank you. Now we are going to observe for the longest diameter and to see the fetal movement which reflects the activity of the fetus. With that, we are now going to wash our hands. This is to protect ourselves and of course to protect the people around us. We are going to use a hot water to warm our hands, or we're going to wash our hands with warm water to keep our hands in a good condition and to avoid contractions to the patient or to the mother. Remember that our mother is always or usually irritable when it comes to touching of her belly. That's why we have to keep it fast and convenient. So for the first maneuver or the fundal grip, we are going to start with exposing the area of the procedure, which is the belly. Going to, ma'am, may I lift your shirt?
Yes, ma'am.
Okay. Okay, gently. And then we are going to face our patient. The next thing that we are going to do is to feel over here and palpate over here. And then we are going to check if it's hard, round, and freely movable. We can say that it's the head. If you feel that it's soft and it's a less well-defined, then it could be breech. We are going to do this in order to determine the consistency and also the shape and mobility. Okay? Ma'am, I'm going to apply some pressure. It's okay?
Okay.
Okay. But we have to be gentle in doing this. The next thing that we are going to do is the second maneuver, which is also called the umbilical grip. The first thing that we are going to do, we're going to place our hands over right here, and we're going to palpate downwards on the lateral uterine surface and determine the fetal back or the fetal extremities. We're going to apply a deep yet gentle pressure. The main purpose of this is to locate the direction of fetal back is facing. One hand feels a smooth, hard, and resistant surface, which is the back. And the other one feels number of angular nodulations, which are knees and elbows. Okay, we are going to move on onto the third maneuver, which is also called the Leopold'S grip. And we are going to place our hands on the symphysis pubis. Mom, would it be alright if I touch over here?
Yes, ma'am.
Okay. We're going to grasp the lower uterine segment using the thumb and our fingers. And then we're going to try to press it in here. This is also for us to determine if the engagement has occurred. If the hands press together, then it's not yet occurred or it's not yet engaged. But if the hands not pressed together, then it's already or the engagement has occurred. Remember that if the part is not firm, then it is the head, and if part is soft, then it's breech. Now let's move on to the fourth maneuver, which is also called the pelvic grip. This is done to verify the result of the third maneuver and also to determine the presenting part that is located on the hypogastrium of the mother. The first thing that we're going to do is to place our hand on the lower abdominal and palpate it. We are going to determine the cephalic prominence. If the prominence is at the same side of the fetal extremities, then the head is flexed. And if the prominent is at the same side as of the back, then the head is extended. I'm going to press it like that, gently. Remember that if the node of the brow is easily palpated, the fetus is probably in a posterior position. Remember that this procedure, the Leopold'S maneuver, is very and we are done doing the 4 maneuvers. The next thing that we are going to do is to listen to the heartbeat of the fetus, and we are going to use the stethoscope. And we're going to locate for the fetal or the fetal back, and we're going to put the stethoscope over it. Okay. We're going to listen to it for about a minute. After listening to the heartbeat of the fetus, we are now going to close or cover the tummy of the mother. And now we are done with the 4 maneuvers, and I've also listened to the heartbeat of the fetus of her baby. And now we are going to explain to her what are the results of the procedure. Ma'am, I have found out that your baby is on a cephalic position, which is only normal, and the cephalic also means that your baby's head is on the lower part of your uterus, which is an ideal position. And of course, I have listened to the heartbeat of your baby, which is about 125 beats per minute, which is normal. So far, I haven't seen and I haven't noticed any complications on your belly, which is very good. Do you have any questions, ma'am?
No, ma'am, thank you.
Okay, thank you, ma'am. So after doing the procedure, we are going to proceed on the bathroom and wash our hands. This is to protect ourselves and to protect the people around us.